the number of people who I've spoken to in the field of medicine specifically, who are now starting to come around at understanding that food is actually a really important part of healthcare and prevention specifically. And that was something that I would say 5 to 10 years ago, anything to do with food and medicine, it was just not regarded at all. And there was no room for discussion.
So just boring stats, let me give you some. If you look at every country on this planet, I would say out of the top 10 risk factors that are driving mortality or morbidity, premature mortality and morbidity in that country, 5 of them are related to what we eat.
Wow.
So it's, overweight, obesity, high blood pressure, high cholesterol, high added sugar consumption, you name it. It's 5 of the top 10. Some countries it's 6. So that's a really interesting fact. And I've been trying to communicate to my colleagues in the health system that, what happens in the food system is essentially bankrupting the health system. It's making it, the number of people who are losing limbs from diabetes type 2 in the UK is astonishing.
Really?
It's absolutely astonishing. And this is eating up resources in the health sector. Then I heard another colleague of mine was doing some work and said, do you know how many days a doctor in the US studies nutrition? Yeah. Do you know this factoid? It's 5 days. It's a week. Out of how many years? And in reality, they only study 4 hours out of they should do 5 days. But it's extraordinary, isn't it? These worlds are so separate when they're so interlinked.
I agree. And I think, as I said, it's been interesting to see, even through work that we've done with Imperial College's Cancer Research UK lab that they have there, just the openness now to having discussions around this. But at the same time, it's interesting to see that a lot of people who are working as researchers in that field don't exactly know how to go about both finding the funding for this kind of research and implementing it, because as I said, it seems to be very messy. And then it comes down to actually one of the kind of topics that we've got here, which is this idea of precision nutrition, and this idea that we will all metabolize food in very individual ways. One of the largest studies at the moment is going on between King's College, Massachusetts General Hospital, and Zoe, which is a nutritional science company run by Tim Spector, I believe. And it's interesting in a way that we're kind of opening up these discussions, but at the same time, there still is that resistance towards looking at the role that food plays within healthcare. I don't think people know exactly where to slot that in or where that fits in. But if we talk about prevention, I think a lot of it comes down to diet. And if we look at even well-being, even if we're talking about people who are diagnosed with certain illnesses and diseases, that food plays a vital role in that. But it seems from all the discussions I've had, people intuitively get it, but no one knows what this actually means in practice.
I think there are 3 big problems related to the area you've highlighted. First of all, it sounds amazing, but we don't actually know very well what people eat.
Yeah.
We don't have very good measures of what people eat. A lot of it is self-reported, self-recall. It's not observational. Observational is very expensive. Observational can also change behavior if people know they're being watched. Sure. It's very difficult. That's the first thing. Second thing, we don't know a lot about what is in our foods. We actually don't. I saw a stat the other day that said we know about 10% of the components in vegetables, and a lot of the vegetables we consume. There is lots of other things in them. We don't really know much about them. We don't know what the health consequences of them are. So I'm all for more science and more understanding of what is in particular foods. Mm-hmm. The danger to all of this is we confuse consumers. Yeah. So in every newspaper and every day, we pretty much see meat is good for you, meat is bad for you, coffee is good for you, coffee is bad for you, chocolate is good for you, wine isn't.
Yeah.
So it really undermines the faith the public has in any of the information we pass on to them, especially in Europe and North America, but elsewhere as well. So we do need some kind of mechanism that brings all the scientists together and they can hash out what the consensus is and what the kind of messages are. So in the climate world, there's something called the IPCC. I can't remember what it stands for now, but it's an Intergovernmental Panel on Climate Change. That's what it stands for. And it's scientists around the world, so it's a global picture. It's not just the US or Europe. Do research, and they synthesize their research, and they come up with a unified set of messages to policymakers around the world and in different countries. And I think that's been a very powerful force for change. We don't have anything like that in nutrition. So we need more research on what we eat. We need more research on what's in what we eat, but then we need better ways of aggregating and collating all of that to give a unified, simplified message. Very often, the messages we find that resonate the best in the countries we work in is just eat lots of different vegetables with different colors.